Come and join me as we dive into the world of careers, uncovering the reality behind the job titles you've always wondered about and how you can chart your path to success. Whether you're starting out or dreaming of a new role, I'm here to guide you. Real talk, real jobs, real insight, providing career clarity, one conversation at a time. Welcome to Work Uncovered. Hi, I'm Terry Homans, career consultant and founder of Curated Careers. In today's episode, we're going to be stepping into the world of podiatry. My guest is a senior podiatrist based here on the Gold Coast, specialising in sports, podiatry and biomechanics. He works closely with elite and everyday athletes to optimise performance, reduce injury risk and help people overcome foot pain, with a strong focus on prescription foot orthotics. Alongside his clinical work, he's helped develop an online platform aimed at making high-quality orthotic care more accessible. Welcome, Nathan Chock.
Thanks for having me, Terry. Pleasure to be here.
All right, let's just dive straight in. Can you tell us, for someone who's never heard of this role, how would you describe exactly what it is that you do?
Yeah, so as you've touched upon before, I'm a podiatrist specialising in foot and ankle care on the Gold Coast. As a podiatrist, we see everything in terms of routine care podiatry, which is nails, skin care, calluses, warts, corns, all the way up to probably the bigger picture stuff, which is heel pain, kids' foot pain, ankle pain, knee pain, leg pain, lower limb injuries, those types of things. I think if you probably interviewed majority of people, they would think a podiatrist just cuts toenails, but it's a lot more than just that.
So my next question is then, what do most people commonly misunderstand about this role? And you've already touched on something, because my misconception would have been that you would be looking more at injuries and those types of problems.
Yeah, I think the biggest misunderstanding is that, like we suggested, that most people think it's a very small scope, and it's more so just like routine-based care. Many podiatrists in the profession only do routine-based care, but there's lots that do extensive biomechanics, sports injuries, chronic pain management. In saying that, like, we don't see elite athletes 100% of the day. Might be one or two that come in during the actual clinical day, but you're still applying the same principles to those people that want to just be active, play sport at a recreational level, or simply those who just want to get through the work day or their normal lifestyle without pain.
So let's just go back a little bit. When you were first at school, what kinds of careers were you thinking that you might end up in back then?
Yeah, so I had a father who worked pretty close with the Air Force, so I kind of thought over a period of time that might be a direction that I go to. I also had family influence with the police force, so I thought maybe that was something. I think that kind of goes back to wanting to really look after people and help people. My grandfather was a GP, so yeah, medical-based profession. I had a representative career with the Newcastle Jets football club, so I thought I'd always want to be a professional footballer, but then injuries themselves come along and kind of kill that dream. And then I kind of moved into a physiotherapy-based kind of passion, so started to do that at university before swapping over to podiatry to specialise in sports podiatry.
Okay, and you just raised an important point there, which is part of the reason why this podcast exists, and that is, in the beginning, your initial ideas were formed around what you had been exposed to through your parents and or your grandparents, that type of thing, which is a very common pattern. All right, so you mentioned then that you did go into physiotherapy first and then transferred over. Were there any detours in your path, or did that just play out in a nice sort of linear fashion for you?
Yeah, that just pretty well progressed by itself, really. My uncle is a podiatrist, so when I started to do physiotherapy, he said, kind of, "Why are you doing that? You should come and specialize in sports podiatry versus just be another physio." And kind of made sense to me. Like driving down the local street, you'd see, 2, 3, 4 physio clinics around, but you'd never really see a podiatry clinic. So to make a difference, not be the same as everybody else, I thought I'll chase that dream. And just the pure instinct with still working with sports people is kind of the key, that the reason why I wanted to do physiotherapy in the first place. But yeah, I wouldn't change it for a world now.
So you went straight into study. Did you also work in those years when you were studying? Because I know most people, don't have the privilege of just being able to study. Pretty much everybody has to earn some dollars along the way. Did you do anything towards that?
Yeah, so I think probably rewinding a little bit, we were that family that as soon as we hit 13 and 9 months, we're down at McDonald's knocking on the door looking for a job. So my first, I suppose, casual job was McDonald's as a 13, 14-year-old. And I actually stayed there all the way up until would have been university time. So probably a good 7, 8 years, I suppose, of working there. It was reducing over a period of time because the study increased, but um, yeah, I had that role. Kind of then had a few different roles with different local companies, kind of just different experiences. But I suppose they all shape who I am now, because you go through different workforces with just different people, and with different people you take some good, you take some bad, and it manages to kind of shape who you are in terms of the values and the beliefs that you want to go forward.
You've touched on something there that I was going to ask you next too. So then look, because that's quite a substantial work history prior to even leaving school. So, and you've also said that you've actually did quite a few roles as well. So what skills do you think you built in those early days that have really helped you progress into the role that you do now?
Yeah, so the number one would definitely be communication. I have to speak to maximum 20, 22 patients a day. Sometimes it's a little bit less, but you're still communicating with people. That can be at a high level, that can be at a lower level communication, but that's definitely one that you pick up over a period of time, because even working with different people, you can just see that people just don't really communicate very well. It's not really one that's taught, so you kind of have to increase that, I suppose, skill over a period of time. So that's probably the general main one.
That's interesting you say that, because I think almost every guest I've had, that's pretty much been the first thing that they mentioned. And as you just said, it's not something that's really taught to us in schools. I think it's maybe just an assumed acquiring of that knowledge. It's not something that's actually focused on specifically, other than maybe writing. If you're writing assignments, you're communicating an idea there, but that can be quite different to actually communicating to people on all sorts of different levels, and especially in what you do, you have to be able to communicate because I'm assuming you're educating your clients, you're giving them exercises to take away. And so if you can't get your point across, then it all falls down at that point.
Yeah, definitely. When we go to university, you get taught at a high level of how to communicate. But it comes down to communicating in like more layman's terms and pretty simple ideas with lots of patients, because they actually have not done the degree. So I need to pass on information and communicate with them exactly what I need them to do, and work with them to, um, shape the goals that are going to improve their pain levels, I suppose, over time, but definitely their performance.
Looking back to when you started out in this role and then where you are now, has the role changed or evolved at all, or is it pretty much sort of still the same?
Over time, it definitely shifts. It would have changed from being more primarily hands-on treatment focused, routine care. There's a lot stronger focus now on biomechanics, load management, footwear,
Mhm.
long-term planning rather than just short-term fixes. Patient expectation has always changed, so people are more informed now, but they're often more time poor and outcome focused. The communication and the setting of expectations has definitely become more central to the role, not just like an add-on that previously would have been the case.
We mentioned this slightly before, but not specifically. What takes up most of your time that people don't realize?
Report writing and assessment reports would take up majority of my time. Seeing a patient is that 30 to 45 minute role, which goes very quickly, but it's the after report writing, treatment note writing that definitely takes its toll.
And then just in terms of the logistics of that, do you tend to allocate time after each appointment where you're furiously writing those case notes, or do your clients just sitting waiting one after the other, and at the end of the day you just have to sort of backtrack and you've got that hour or something or 2 hours, however long it takes, to then sit and plow through all of that?
I do the latter one, so I definitely am one who doesn't want to have many people waiting. I think everyone thinks I run on time fairly well, but that's probably a detriment to me at the end of the day, going back and writing my notes and report writing, which could be an hour after work. It could be something I do at home after dinner. So I'm definitely one who does it more outside of work hours versus inside. But we have lots of practitioners who would prefer to do it inside the actual clinical space, and that's perfectly fine. I suppose the key thing is I don't really know what case is coming in for that 30, 45-minute appointment. So if that 45-minute appointment needs a little bit longer, or there's a little bit more complexity to that, then I don't want that to take up with my note writing. So I prefer to do the job, do what I need to do in that time, and I can always catch up later.
So you talked about what drew you to the profession originally. What were your expectations back then, and did it turn out to be what you thought it would be, or have there been some surprises along the way that you weren't expecting?
Gets probably drawn to a point that I knew it was going to be. I think early days you really just want to get into the clinical environment and work with patients, complete each day and learn as you go. Definitely over the past probably 3 to 4 years has improved sports clinically. So I'm seeing lots of different types of patients, whether they are your mum and dad athlete who wants to run a park run on a Saturday, or those sports people that we see on TV every weekend. That's increased over a period of time, and I'm kind of honoured because I don't think a lot of podiatrists get that. So they don't all get to experience that. So I'm in a position where, with hard work, comes some of that reward, but at the same time, yeah, it's always been a positive that's come out of it. Negativity wise, I don't think there's been too many. Um, we all get patients who are a little bit more complex, and I suppose over a period of time, it just takes a little bit longer to improve them, which can definitely increase the frustration at times. Not so for them, I suppose, but definitely for me.
I'm glad that it panned out pretty much how you expected, because very often, and again, this is another reason why I do this, people have a perception of a role and then they start it and it ends up being something completely different.
I suppose I am maybe a little bit of an outlier. I've been in the role for probably 8 to 9 years now, but the stat is majority of podiatrists only last 5 years. So I think from an expectation point of view, people may have a little bit more higher expectation when they actually do start the role. So we have had some new graduate podiatrists who start with us for 18 months, 2 years, and then they leave the profession altogether. That's not necessarily just from us, but the expectation or the responsibilities that they may have had to endure over that time wasn't what they were thinking. So I'm definitely one who has probably battled through that 5 years. It hasn't really been too hard to get post 5 years, but there are definitely a lot of people that do.
Do you, obviously, I'm not asking you to be a data expert on your profession, but just in general, what you know of what things, what might have been different that people wouldn't have been expecting, maybe?
It's always really hard to kind of work that out. I think the rhythm of like back-to-back appointments, staying fully present with every single appointment, and managing conditions and I suppose client expectations can be a bit more draining. Um, I do know some podiatrists who struggle with the ongoing nature of seeing the same types of patients repeatedly, and maybe that has whacked their career progression a little bit, but it's hard for me to tell you exactly why the 5-year number is there, but I could only really kind of think it's due to that.
So then are there any skills then that matter more now that weren't so much needed at the beginning?
Yeah, I think the communication one is key. People tend to do well when they explain that complex concepts in simple layman's terms. You have to set really realistic expectations. So, that might be a slow progression, but over a period of time, the expectation or the communication is definitely key.
Is there anything that has become harder over time, apart from this general sort of attrition, I guess, that seems to wear people down a bit? Is there any particular thing that's made it more difficult as you've progressed?
I think the challenge of adapting, like the knowledge and the approach to every single person's lifestyle and activity level, the goals and the constraints. For example, like helping an office worker manage chronic heel pain requires a very different approach than supporting an elite athlete trying to get back to returning to play. So I guess that's a challenge in itself. But with small improvements and adjusting different things over time, it's certainly been manageable.
What tends to wear people down in this career then?
It's a good question. Those who tend to thrive are the ones that are happy with the constant progression, but those who don't really thrive are probably looking for like a real sharp, rapid results, which doesn't really come with this type of profession. It's the repetitive nature, patient expectation, education, explaining the same principles, managing the chronic conditions where progress definitely can be slow. Where I do know highly trained clinicians who find themselves fairly frustrated at that. So I guess over time, it's the satisfaction that reduces that.
Okay. And I'm glad you said there, the sort of really highly trained people, because one of my questions was what makes highly capable people also stumble or perhaps leave the profession? And I just wanted to back that up with another question. You mentioned that you think sometimes it might be that, you're not necessarily seeing those results quickly. I imagine a lot of people might sort of come and see you, maybe have 1 or 2 sessions or something, and then they don't actually ever come back and they maybe don't follow through with what they're supposed to do. And so you as the clinician, maybe don't see the results at all. Is that something that happens?
Yeah, that happens. I think a lot of that is the patient expectation. So setting appropriate goals and goal management's a really important one. So those SMART goals that we get taught, all about having to be measurable and accurate within a certain period of time. So there are certain people that might be a little bit more complex. It does take a bit of time, but there's no point promising the world for fixing someone's heel pain that has been there for 4 years in 3 weeks. It's going to take a lot longer than that.
I guess too, though, you might not necessarily get that positive feedback or see those results, because if a patient's problem gets better, they're not necessarily coming back to you to say, hey, thanks, that's actually fixed. You know what I mean? They might go away and say, oh, well, my problem is fixed now. I don't need to go back. So I don't know if that affects people just psychologically, how they view the output of their work.
Yeah, so I suppose the patients that we see often and that we do set those expectations that over a period of time we can manage, we are probably seeing them more often because it might be like an every 2-week period of time where they come back in. But I definitely see patients annually, and even those annual checkups, they come in with a problem. We might adjust something. We might prescribe a new prescription with their orthotic. We might get them in a different shoe. And they might actually think that everything's fixed in a week, and we never know. But we have a nice little protocol here where we actually we'll physically call that patient within 2 to 3 week mark if we have not seen them, just to see how they're going, but also to work out how our goal guidelines went for that period of time.
What actually determines progression in this field?
Progression's definitely not automatic. And like I touched on before, it's rarely determined by the clinical skill of a practitioner. Early on, like that technical competence will lead to probably more responsibility and opportunities, but over time, definitely the communication, the decision making confidence, and I suppose understanding the broader context, like the business, patient management, workflow, they all matter just as much as the technical outside output. People who stay long term are usually those active or fairly active in a role of shaping their career rather than waiting for it to evolve on its own. That might mean specializing in different parts of podiatry or mentoring junior clinicians. Taking on a leadership role, but it definitely comes from identifying what you enjoy and what you want to do rather than letting it just come by itself.
And I think that's the same anywhere, especially in this day and age. Progression in a role is no longer a given. That's a pretty rare thing these days. I think if you want to progress, you actively have to work at that and chase it down and make it known and upskill. What does success in this role look like beyond maybe your job title or how senior you are?
I think success for me on a day-to-day basis is improving people's lifestyle. On a daily measure, I'll see patients who come back and tell me that I've changed their life really, more so from having that chronic heel pain for 4 years and fixing it within a period of time. So definitely success starts from there. Over a longer period of time, though, staying within the career and with the profession and progressing over a period of time. I'm now in a leadership role. I help juniors who come through. Um, Definitely more sports specialized now. So that's all progressed over a period of time, but that hasn't come by itself. That's definitely come from a hardworking environment. But that was one that was shaped with my junior roles before. So I definitely think it all kind of has a bigger picture leading to that successful outcome now.
What kinds of challenges do people in this role tend to really enjoy and be motivated by rather than have those challenges be a stressful event?
Yeah, so as a profession, it definitely rewards those who enjoy problem solving. You might see similar movement patterns and gait pathologies very repeatedly, but no two people are the same. So the challenge comes from adapting the knowledge and the approach to each person's lifestyle, goals, and constraints. For example, like we said before, helping that office worker with a chronic heel pain definitely is a different approach from someone who's a elite athlete who wants to return to play within a very short period of time. It definitely suits those
Mhm.
people who like incremental progress, monitoring small improvements over time, or adjusting different exercises or load management, refining like footwear and orthotics for people. It also rewards those who want to be hands on and clinically present from a day to day perspective as well.
Can you expand on what are the more exciting aspects of your role that probably don't take up as much time, but I guess would add a little sweetener to what you do?
There's definitely that unique satisfaction in watching someone go from a very frustrated point of their life, or even like fear of never getting better, or no confidence in returning to what they need to get back to, whether that's general exercise or
Mhm.
walking around, or whether that's an elite player. Um, for some people, it means that they could never get back to that play again. So um, helping that from an individual basis is really cool. I see so many young kids, and lots of kids will present with more ongoing heel pain, which all comes from activity. Activity improves their lifestyle. They enjoy it; it's fun. But when they have the heel pain, they can't do that. So I think having someone like that who comes in with a mum, with a dad, have been told to do something for treatment and doesn't help, hopefully improving their foot mechanics and improving their support and stability around the foot allows them to return to play, and that allows them to stay on the field, and that improves our athletes. I think from a personal role, I enjoy watching lots of sports on TV, so golfers, rugby league, football. So having a daily experience with those types of people is really cool as well.
you're talking about that sort of broadly, or are you talking about actually the work that you do get to do with elite athletes?
Yeah, so I do get to experience that from a day-to-day perspective. So that doesn't mean I'm going into the sporting environment training every single day, but I'll regularly see players at an elite level who present to me for treatment on some lower limb injuries, or definitely improving their mechanics. So one thing that everyone kind of overlooks as well is that everyone kind of has probably had the focus that a foot orthotic is for grandma who can't walk anymore. But over a period of time, orthotics that we will do is that mouth guard for the teeth on an NRL player or a junior player. So it's all equipment based. It's improving stability. It's improving the comfort from the boot for sure. And it allows that player to improve their performance and stay on the field and reduce the lower limb stress. So we use it as an advantage versus let's just heal tissue that's uncomfortable at the moment.
I mentioned in the bio that you've developed an online platform around this kind of stuff. Did you want to talk about that at all?
But archery is less likely to be in any headlines versus a physiotherapist. So everyone knows, elite physiotherapy is sitting on the sideline and watching players play every day. As a podiatrist, I don't get to do that. Um, so we're not as known. So people in outback Australia, different parts of the country need access to different types of things. So we've developed an online platform through Absolute Foot Care here, the company that I work with, to allow others around Australia to get the same access. So pretty much what happens, Terry, is that patient can do a video gait analysis at their house to upload that file, so we can actually visually see how they walk and how they move. They complete the assessment online, and then within 7 days, we can design, manufacture, and have their orthotics at their doorstep.
And that's one of the great areas technology is helping us these days, right? We're actually now able to provide care to people who otherwise would not have been able to get
Yeah,
it.
I think the key in the decision around this was I've had a patient before who had to drive within 2 hours to get to a clinic, and they did not want to do that. I saw someone in their family, and then someone in that family found out that I did this, and they sent them the link. And you can imagine that driving 2 hours to a clinic just for an assessment, which is a ideal assessment, we need that assessment, but it's a 2 hour trip. It's a consultation cost. It's a 2 hour drive back. It's normally about a week or a 10-day period for us to manufacture and make the orthotic. So then we drive back 2 hours. We have the orthotic prescription consultation. We have that dispensed into our footwear. Then we drive 2 hours back. So with this idea, it's technically saving that person 8 hour trip. Probably from a financial cost, that improves that. Definitely exciting long term, but it's trying to bring awareness to people who might need that type of treatment as well.
I love it. That's fantastic. So you talked earlier about a decent enough drop off around that sort of 5 year mark, maybe. Is there anything that becomes really rewarding, but you've kind of really got to stick it out so that those people who are dropping off earlier are just not seeing some sort of big reward?
Yeah, so I think there's a few different paths with podiatry. So we can just become a general podiatrist. That general podiatrist sees a decent amount of patients per day, which definitely,
Uh-huh.
from a financial perspective, can have a really good life. There's others that will stick it out and go and make their own podiatry practice, which is from then a business mindset, going to be something a little bit more worthwhile and valuable over a period of time. There's others who go into specialized roles. So there's lots of different little niches of podiatry that probably don't really get explained very well. I think going around to different universities and even, I suppose, myself choosing a career, you think, what is podiatry? And then people say, oh, it's to do with feet. No one likes feet. Let's not do feet. But definitely getting over that period of time and seeing what's under the hood definitely has evolved over that period of time. And I'm very thankful to have had 8 or 9 good years. I certainly have I didn't drop out after 5.
So, Nathan, can you tell me then who is going to thrive in this profession long term?
It's a never changing industry, the medical field. So it's normally those who are fairly adaptable, patient, and probably more proactive. Those who definitely enjoy applying like a clinical skill set consistently over a period of time. They enjoy problem solving in real time and are seeing probably the small wins over time add up with different patient workloads. The biggest thing is that you can kind of control your own career. So I've touched on it a couple of times before where I shape the workload that I want to see in terms of clients, patients, and different specializations. So the sports biomechanic, you can become someone who very much wants to mentor young clinicians, want to see a high volume of patients, but definitely a problem-solving background, and definitely those who communicate very strongly seem to thrive in this industry.
That's given me a really nice, well-rounded picture of what you do. So I'm going to talk to your story specifically. Can you tell me what's the best career advice that you ignored initially, but later on realised was right?
I didn't really know what the term bedside manner was. I think majority of people say I've got a really good bedside manner in terms of patient communication. I think at the time you hear this, you go, what does bedside manner mean? Like, it doesn't really mean much. But I think it just comes down to communication skills and having the ability to change how you say something over a period of time to leave a mark on that patient. So if I was going to tell someone a piece of education advice or exercise therapy advice, I might have to do that completely different from someone else. So I think being able to change tact and doing that is the biggest thing I didn't know how to do initially, but definitely over time have found out it's the most important.
That's an interesting point because I think maybe that's one of those things you don't know what it is until it's not there. You know, when you step in and you see some kind of physician who doesn't have it and there's a real stark difference, and then you really notice and go, oh, wow, they've got a terrible bedside manner, just, clinical, abrupt. I have a GP who's like that, and he's just do this, do this, do this. And I always leave going, did I do something wrong? As opposed to leaving your clinic and it's like, chatting to your friend who's given you some great friendly advice and off you go. It's just that real, and you, I have studied quite a bit of anatomy and physiology, and you could talk to me in all the jargon and I would be fine, but you don't do that until I actually point out to you, yes, I actually know those terms. You can just hit me with them. That's fine. But, until that, for instance, when you speak to my son, you very much talk to someone who doesn't have that sort of medical knowledge.
I think at the end of the day, if we can look at the result as being the outcome, doesn't matter how we get there, we just have to get there. It could take forever, it could take a little bit less time. But yeah, there's no point giving education that you've got no idea. I think that every appointment that I see, I think I want that person to walk out thinking or knowing, hey, I understand what's happened. I know now the goal, how we're going to fix it, and hopefully that isn't a very short period of time. But sometimes it's a long time. Prognosis is a really tricky thing. I think the biggest compliment I ever had, I do know someone who is fairly high in Griffith University, Bachelor of Medicine, and he teaches students and trainee doctors how to speak and communicate. And he said I had a really good bedside manner. He goes, "Oh, you can communicate better than any other person that I see in the actual in the Bachelor of Medicine." So I suppose that took a nice positive note for myself.
Absolutely. Congratulations. And I concur.
Thank you.
All right. If you had to start again, what would you focus on first? Would you do anything differently?
I don't think I would do anything differently. I finished university, started off in a really well-rounded clinic, not this current clinic. It was a different type of, different clinic. Same sort of clinical patients, probably less responsibility, but you get that as a new grad. But yeah, through, I suppose, sound technical knowledge, through showing interest, knowledge, and I suppose that business mindset got me to where I am now. So yeah, I don't think I'd actually change. As boring as that answer is, I think I'm happy with exactly what I've done.
No, boring can sometimes be really good. If it means you've had a really nice, pleasant, even journey along the way, I'd say that's great because many people don't get that. If you were going to give your 18-year-old self some advice, what would you tell them to try sooner?
I've always been fairly conservative. I think taking a qualified risk is a really good thing to do. It probably hasn't changed the pathway that I'm on now, but it might have opened doors a little bit sooner. I think my 30-year-old self now would probably tell my 18-year-old self to smile more and enjoy the journey. I'm very much result driven. Let's get to the next thing, then tick that off and go to another one. Whereas I think everyday life should be enjoyed at the moment. Life's too short. So, yeah, just enjoy it.
So you're very eye on the prize, but not necessarily enjoying the ride along the way or enjoying the wins along the way.
I'm definitely starting to enjoy the wins. I think I've always enjoyed the wins. But
Yeah.
the old saying, stop and smell the roses, is probably not a bad one for me at the moment.
I think both of those things to your 18-year-old self and what you've just said here are both great pieces of advice. I'm very risk averse, and as often happens when you take a nice, well examined, calculated risk, the benefits are actually generally really good and worthwhile. Often quote a Tori Amos song where she says, "If you jump, best jump far."
Yeah.
So that's how I tend to go. Lastly, and most importantly, if people would like to come and enjoy some of your bedside manner, where can they find you? Where's your business?
Yeah, so I work with a company called Absolute Foot Care. We're located on the Gold Coast. We've got 2 clinics. There's one in Runaway Bay. We've also got a clinic in Southport. You can jump on the details below and see our website and the handles that you'll be able to find me, or the contact details. Hopefully people aren't needing to see me from a pain management point of view, even just the prevention of different types of clinical conditions that can come up that kind of get blown to the side a little bit along the way. People always talk about going overseas and walking in, different countries and different environments, and the terrain's always different. So if you have your normal foot with a shoe that's not as supportive and you're going into do 20,000 steps a day, you're probably asking for something to happen if you're not well supported or without the right shoes. So, yeah, feel free to come along, book a time, book an appointment. We'll certainly have an assessment anytime they need. We can always have a look.
I can absolutely concur on that point, because I did come to see you at the end of last year with some foot pain and a whole bunch of unexplained bruising, and we sorted that out, and I then proceeded to hop off to Japan and walk about 30 kilometers a day with no issues whatsoever. So thank you. Nathan, it has been my absolute pleasure chatting with you today, and I'm very appreciative of your time, your day off, I've just discovered, and I look forward to perhaps just waving as I go past your office, not necessarily having to come in for future foot-related problems.
I'm more than happy to help out anytime.
All those credits will be coming up shortly after I do the key takeaways from this clip, so make sure you check those at the end. Once again, Nathan, thanks very much. You can go back to enjoying the rest of your day off now.
Thanks so much, Terry. Appreciate it.
Before we finish up, here are 3 key takeaways from my conversation with Nathan. Firstly, many people think podiatry is routine nail and skin care. In reality, it spans biomechanics, sports injuries, chronic pain management, orthotics, load management, and performance optimization. The same principles used with elite athletes are applied to everyday people who simply want to walk, work, or run without pain. The scope is much broader, more technical, and more performance-focused than most people realise. Secondly, clinical skill matters, but what keeps podiatrists effective and in the profession is communication. Success depends on explaining complex biomechanics in simple language, setting realistic timelines, and managing patient expectations when progress is slow. This is not a quick fix profession. It rewards people who are comfortable with incremental improvement, repetition, and long-term problem solving. That 5-year dropout statistic highlights something important. If you expect rapid wins and dramatic transformations, you may burn out. If you value steady progress and patient education, you will likely thrive. And lastly, podiatry is no longer confined to a clinic room. From video gait analysis to remotely designed orthotics delivered within days, technology is expanding access, especially for rural and regional patients. At the same time, career progression is not automatic. Growth comes from choosing a niche, building expertise, mentoring others, or moving into leadership or business ownership. In other words, podiatry can be as general or as specialised as you choose to make it. The ceiling is shaped by initiative, not just qualifications. If you enjoyed my conversation today with Nathan and you'd like to see more of this type of content, be sure to like and subscribe. You can also share this with anyone who you think might benefit from hearing this kind of information. And if there's a profession that you'd like to hear about, make sure that you leave me a comment below and I'll see if I can turn that into a future episode for you. Thanks for joining me this week on Work Uncovered. And until next time, remember, you can't be what you can't see, so always be curious.